thank Bill for that presentation and gave us a lot to think about. So we have a couple of questions, and I've got some as well. So we spent yesterday and today talking about, creating this movement so that every person, every entity, every community would believe and act as if they're in the health business and that health is their business. So here's one of the frets I have for the people in this room, and that is that they will overthink it.
This is a fret or a threat?
Fret.
Okay, a fret.
That they will overthink it. So my question to you is, how do we get smart people who are often mired in volumes of strategic plans and who work in oppressive and cumbersome systems to just act and to do the buckshot that you talked about?
So one of the things I'm a huge fan in, and so I've been doing government reform work and public-private partnerships now for a long, long time, 27 years probably. And one area that I think is so powerful is what's called human-centered design and design thinking. And that's basically saying, we're not going to spend a lot of time doing all of the, sitting in ivory tower doing the studies. We're going to get out there and see how people actually interact with things and watch them do ethnographic research. And then we're going to co-create the solutions with them. We're going to co-create them, and we're going to develop, and we're going to iterate, and it's not going to be perfect the first time. We're going to keep on iterating and iterating around it. That's where we're seeing a lot of really interesting solutions that are occurring right now, and it's by basically saying that we don't have all the answers. You start from a place of ignorance, and when you start from a place of ignorance, it helps you to be able to walk in their shoes. And I think getting out there and doing a lot more of that, and we heard, obviously Tiffany talking about that earlier today. The other one thing I would say is that we look at these big kind of meta problems, and it just seems so complex, and people get some of it just starting very small. So my wife is a professional ballerina, and so they spend all of their time sitting up very, very straight and teaching me how to sit up, and it turns out that lower back pain is the biggest cost to our healthcare system today, right? And you can go around any office in America or any school and see everyone like this and just saying, that's going to be a massive thing. And just literally the small thing is just going into schools, going into companies, and people just helping them, teaching people how to sit up straight on their computer, right?
Yes.
That seems like such a small thing, but if you could scale that, that's billions of dollars in savings and a lot less lower back pain for people.
Great. So we've also, the last couple of days, talked about the importance of language. So Tiffany was talking about, you don't say we're coming to help you, but we're coming to serve you. And we heard yesterday also that, we don't go to a community and say, we're here, again, to help you, but we're here because we need you to help us. So, but I noticed you used some very powerful language. So you used words like wicked, thorny, gut-wrenching, moral, colliders. Why those words? And how do using that language help us in our movement and our communication?
Well, I was just trying to get people to not fall asleep after lunch, and so that was just to keep you ready. No, I do think in general, sometimes, as a writer in a language that is evocative, that is about doing things, and that has a very specific sort of meanings. Is important, and it also can inspire, I think, people to want to do these things in a different way. If you look at a lot of what we wrote about in the book, we talked about things like solution ecosystems and a lot of things that people hadn't heard those before, but then after they saw it, they're like, oh, I'm actually doing some of that. I'm involved in some of that, and trying to get people to kind of look outside where they are today. Like, again, and what I love with what the Colorado Health Foundation is doing with startups right now, and because that's actually really important. Business model innovation is such a key element of the solutions to some of these problems, but that's not something you typically hear a lot about in government or even foundations. And so trying to bring new language into those.
So how do you get myself and my colleagues in the public sector to not think of social entrepreneurship as something that somebody else does, that it happens out there and not in here? How did you get us to be social entrepreneurs?
Well, it's actually it's a big problem both ways in some respects, because a lot of the first generation of social entrepreneurs, and we interviewed hundreds of them, they basically said, we don't want anything to do with government at the time, because we don't want to get wrapped up in bureaucracy and the procurement systems and this and that, and we want to just go and do it. And yet government's the biggest funder of all of these systems. And government can do a lot from a regulatory standpoint to make it much more difficult for these social entrepreneurs. So the two sides really need to understand each other in a big way. I just came from San Francisco, where the city is doing something really interesting. So San Francisco, obviously a huge tech community there, and they want to be the capital of the world in the Internet of Things. And they said, you know what? We could use the city and city services as a sandbox for startups and others that were trying to do interesting things, and work with our departments to find solutions, but also give them use cases. And so what happens is that there's entrepreneurs and residents are literally sitting there with government employees, and they're working these things through together. It's a great model. We need to do a lot more of that, where you're actually seeing them as partners, right? And figuring out the right incentives to make it worthwhile for both entities. More and more cities are starting to actually create their own incubators. That's a really interesting model. You can see that happening with, whether foundations or governments in the healthcare space.
So from the audience, someone says that partnerships with industries sometimes drives up healthcare costs, and that they're hopeful but skeptical. So how can we prevent that from happening?
It drives up healthcare costs. I'd have to learn a little bit more about how that happens. But if you think about how important industry is in many respects, most people, that's where they're spending, their company or their organization, that's where they're spending most of their day. Mm-hmm. And they're either healthy or not healthy there. I know wellness is absolutely a huge, huge issue now at Deloitte. And it's not just a cost issue, but we've got a huge percentage of our workers are under 35 years old. And they basically want to be in a very healthy environment with healthy food and so forth, and they want actually incentives from the insurance companies to make that happen. And I think it's working with those companies really, really closely. I mean, and that's where you can get 10, 15,000 people, more healthy, and then they're working out in the schools and so forth. But I think that's as good a test bed as schools, right? In terms of hubs, because many communities, that's where the biggest employers are, and also local governments at the same time. I find it interesting. I did a lot of work on bike commuting and ride sharing and carpooling, and the massive reductions in congestion and other positive benefits from that. And yet most governments actually who should be promoting it don't really have very active carpooling or bike commuting programs. And then that's a case where I think governments and employers can be out front in starting to get that societal change happening more quickly.
As you look around the next corner, what's the next wicked problem we should already be thinking about before it gets here?
The next wicked problem. Well, let me say what I think is going to be one of the biggest opportunities. So if you look in the course of history, so we hear a lot about automation, right? And how that's going to take so many jobs away. 40% of jobs are going to be eliminated through automation. So if you're looking at a wicked problem, if that was the case, that's our biggest wicked problem, massive unemployment, if you believe that. But actually, every other period in human history, there's more jobs that were created due to technology than not, and new industries emerged.
Usually the people that have to come repair it when it doesn't work.
Yeah, although someone's got to repair the robots. But I think, so in the Industrial Revolution and earlier, the big new multi-trillion-dollar industry that emerged was leisure and travel. 100 years ago, only 1% of the population or less had enough money to even think about that. It wasn't an industry, and it emerged. And I think that next multi-trillion-dollar industry, especially as we get more leisure time, is going to be wellness in many respects. And I think there's going to be all sorts of innovation occurring that I talked about, and it's going to look radically different in 5 or 7 years than it does today, with wearables and analytics and injectables and all sorts of other things that I think will scale all the way down, through usually these sort of things, the way technologies move, it's the first movers, and then they kind of rapidly scale to the rest of the population. I think that's what we're going to see. And so understanding that landscape is going to be really important.
Great. One last question from the audience. How does power differential determine how and when we use market-based approaches to those wicked problems?
So what's been interesting about this, so if you think about the India example, all of these innovations that we've seen in healthcare and other areas in India is actually, they were all aimed at the bottom, the bottom of the pyramid, essentially. The couple billion people, who previously were excluded from markets. And we looked at that also with Project Shakti. And so increasingly, companies and others are understanding that this is a market that you can't ignore, and it's an incredible market if you can get your business model right, because there are billions of people. And that's a big change. 15 years ago, we had half of the world population was almost completely excluded from markets in general. And I think just driving that down, figuring out what the business models are that will work for low-income people is going to be really key.
Thank you. Let's thank Bill again.
Thank you.
Thank you.
So I was supposed to say, I think you all are getting a copy of the book when you leave.
Oh,
okay?
I didn't know that either.
And then I'll be out there to sign all 550 just in about 2 minutes, but I will be out there if you want to talk. And look forward to meeting you all.
Great, thank you. So before we break for the afternoon sessions, I have again a couple more things to say about the movement. One, as I said before, so I've got some do's and don'ts. The don't is don't overthink it. You all are already doing it by just some of the questions you're asking. Don't overthink it. And don't wait or expect the foundation is going to lead this. You all go ahead, we'll catch up. So this can't be something that is just ours, that we're leading, otherwise it won't be real or genuine. So don't look, we may take one of those roles that Bill talked about. We might be an ecosystem integrator or an innovation engine, but you don't have to wait for us to move, for you to move. This isn't Simon Says. You all get busy. Now, on the do side, I don't think we have to go to Haiti or Africa to find some service buildings that just suck the soul out of a person when you walk in the door. So look around your own building. What is the customer experience like, or the client experience like, when someone enters your workspace? Is it welcoming? Both of my children are adopted, and so particularly with my son, while we were waiting for all the adoption and all, I was a WIC mom and I was a Medicaid mom. And so I would call, the pediatricians to make an appointment for my daughter. Hi, Mrs. McNeil Miller. I'll make an appointment for my daughter, Lindsay. Oh, okay, what day works for you? And so we would then go through this conversation of finding the time that works for me and for Lindsay's schedule. I could call back that same pediatrician the next day. Want to make an appointment for my son, William. Okay, we have you down for 2:30 on Wednesday. Wait, 2:30 on Wednesday doesn't work for me. Well, we only see Medicaid patients on Wednesday and Thursday afternoon, and 2:30 is the time we have for you. Well, that was not welcoming. Now, the doctor herself was fabulous, but she had no idea the differential treatment I was given because I called as a Medicaid person versus a commercial insurer. Now, it was a beautiful building, but it wasn't welcoming. We've got some other places that, what's the welcome like? So you don't have to go very far to think about that. So look in your own space. I would also, with this notion of language, I would love for us to eliminate the words "at risk." Nothing positive ever comes after the words "at risk." Nobody's ever told me that I was at risk of becoming a multimillionaire. Something bad's gonna come after "at risk." So let's think of what's the asset base. You know, our kids and our families are at promise. Our kids and our families are at potential. They're at something positive. They're not at something negative. So I would love for us, as just part of our movement, to change the language of how we talk about the people, the families, and the communities that we are interested in serving. And then last, I would say, you know, back to Tiffany's message, you know, like flip the script. Take some control. You know, I've worked with schools, and I would tell schools, don't wait for a business to adopt you. You go adopt a business. Go to a business and say, my school, we've decided to adopt you. Business, and you know, 3 or 4 times a year, we're gonna come bring our kids to sing. We're gonna come put up art for you. We're gonna come and, you know, show what we did in art class. We're gonna come and we're gonna come and read to you. And you got them engaged that way. So, you know, part of that movement is flipping the script. And the last thing I will say is, I think you all, or we all are all, we're thinking about what it's gonna look like when the wave crests. We got a long way to go before the wave crests. We're talking about this earthquake under the ocean that's gonna create the tsunami that will eventually make land and then crest. So right now, that earthquake under the ocean are all of the relationships that people are talking about, all of the inviting people to the table or asking if we can come to their table. Instead of us inviting them to our table, ask if we can come to their table. So all of the relationships that people are talking about that we need to start and establish and build trust with, that's the earthquake that has to happen under the water to create the tsunami. So again, don't think about the cresting yet. We're not near cresting. We've got to have some tectonic shifts underneath first that we have to do before we can really expect others to follow suit. So those are just a few more thoughts on this movement that we are all interested in engaging in. And so lastly, I've been asked to announce to you that there's a session that's added. If you're on the app, which not all of you are, so get with it. If you're on the app, it shows that there's a new session at 3:10, but for those of you who aren't on the app yet, there's a session at 3:10 to 4 in the Tories 2 room for any of you that are interested in the foundation special projects funding opportunities. There's an opportunity for you to go and hear about that. And we've had tremendous response from that already. And so those of you who didn't get in on the first round and are interested in finding out more about that, please find your way to Tories 2 at 3:10. So have a good afternoon. We'll see you back here at 6 tonight for our reception. Thank you.